Welcome to our comprehensive guide on clinical audit, specifically tailored for the field of diagnostic radiography. In this video, we'll explore what a clinical audit is, why it's essential, and how it helps ensure that radiography services meet the highest standards of patient care. Clinical audits are systematic reviews of practices, measured against agreed standards of best practice. By the end of this video, you'll understand how audits drive continuous improvement and maintain quality in diagnostic imaging. Clinical audit is a quality improvement process that seeks to improve patient care and outcomes through systematic review of care against explicit criteria. In diagnostic radiography, this means evaluating imaging procedures, protocols, and outcomes to ensure they align with established best practice standards. The process involves collecting data, comparing it to standards, and implementing changes where necessary. This cycle helps radiography departments maintain high-quality, safe, and effective imaging services. Clinical audits are crucial in diagnostic radiography because they ensure that imaging practices are not only effective but also safe for patients. By regularly auditing procedures, radiographers can identify gaps between current practice and best practice standards. This proactive approach helps reduce errors, enhance patient safety, and improve diagnostic accuracy. Ultimately, audits foster a culture of accountability and continuous learning within radiography department. Best practice standards in diagnostic radiography are established by professional bodies and regulatory agencies. These standards cover all aspects of imaging, from patient preparation and equipment use to image interpretation and reporting. Auditing against these standards ensures that radiography services are consistent, reliable, and evidence-based. Staying updated with evolving standards is key to maintaining excellence in patient care. Audit cycle is a structured process that guides radiography teams through quality improvement. It typically involves 5 key steps: identifying a topic, setting standards, collecting data, comparing results, and implementing change. This cyclical approach ensures that improvements are ongoing and that standards are continually met or exceeded. Each stage is vital for achieving meaningful and sustainable enhancements in radiographic practice. First step in the audit cycle is selecting a relevant topic. In diagnostic radiography, topics might include patient identification, radiation dose optimization, or image quality assessment. Choosing a topic that addresses a known issue or area for improvement ensures that the audit will have a meaningful impact. Input from the radiography team and stakeholders helps prioritize topics that matter most to patient care. Once a topic is chosen, the next step is to set explicit standards of best practice. These standards are often based on national guidelines, professional recommendations, or local protocols. In radiography, standards might specify acceptable radiation doses, required documentation, or turnaround times for reporting. Clear, measurable standards provide a benchmark for evaluating current practice and identifying areas for improvement. Data collection is a critical phase of the audit process. Radiography teams gather information on current practices, often through reviewing patient records, imaging reports, or direct observation. Accurate data collection ensures that the audit findings are reliable and actionable. It's important to use standardized forms or checklists to maintain consistency and minimize bias during this stage. After data collection, the results are compared against the established standards. This comparison highlights areas where current practice meets, exceeds, or falls short of best practice. In diagnostic radiography, this might reveal issues such as inconsistent documentation or variations in radiation dose. Identifying these gaps is essential for targeting improvements and ensuring patient safety. Final step in the audit cycle is implementing changes based on the audit findings. This may involve revising protocols, providing additional training, or updating equipment. In radiography, effective change management ensures that improvements are adopted and sustained. Ongoing monitoring and re-auditing help confirm that changes have led to better outcomes and that standards continue to be met. Clinical audit is not a one-time event but a continuous process. Regular audits help radiography departments stay aligned with evolving standards and emerging evidence. This commitment to ongoing evaluation and improvement fosters a culture of excellence and ensures that patient care remains at the forefront of practice. Continuous improvement is the hallmark of high-quality radiographic services. Successful clinical audits depend on the collaboration of various team members. Radiographers, radiologists, managers, and support staff all play vital roles in planning, conducting, and acting on audit findings. Clear communication and shared responsibility ensure that audits are thorough and that improvements are effectively implemented. Teamwork is essential for driving positive change in radiography practice. Patients can also contribute to the audit process by providing feedback on their experiences. Involving patients helps ensure that audits address real concerns and improve aspects of care that matter most to them. Patient-centered audits are more likely to result in meaningful changes that enhance satisfaction and outcomes in diagnostic radiography. There are several types of clinical audit, including retrospective, prospective, and concurrent audits. Retrospective audits review past cases, prospective audits plan to collect data going forward, and concurrent audits evaluate ongoing cases. Each type has its advantages and is chosen based on the audit's objectives and available resources in the radiography department. Retrospective audit involves reviewing records and data from cases that have already been completed. In diagnostic radiography, this might mean analyzing imaging reports from the past year to assess compliance with documentation standards. Retrospective audits are useful for identifying trends and areas for improvement based on actual practice. Prospective audits are planned in advance and involve collecting data as new cases occur. In radiography, this could involve monitoring adherence to new protocols over a set period. Prospective audits allow teams to assess the impact of recent changes and ensure that new standards are being followed from the outset. Concurrent audits are conducted while patient care is ongoing. This real-time approach allows radiography teams to identify and address issues as they arise. For example, a concurrent audit might monitor compliance with safety protocols during imaging procedures. This immediate feedback can lead to rapid improvements in practice. Choosing the right criteria is essential for a successful audit. Criteria should be specific, measurable, achievable, relevant, and time-bound. Smart. In radiography, criteria might include the percentage of images meeting quality standards or the proportion of reports completed within a set timeframe. Well-defined criteria ensure that audits are focused and results are actionable. Radiography audits rely on various data sources including patient records, imaging logs, and equipment usage reports. Accessing accurate and comprehensive data is crucial for evaluating current practice. Electronic health records and digital imaging systems have made data collection more efficient and reliable, supporting thorough and effective audits. Once data is collected, it must be carefully analyzed to identify patterns, trends, and areas for improvement. In diagnostic radiography, analysis might reveal recurring issues with image quality or documentation. Using statistical tools and visual aids can help teams interpret the data and communicate findings effectively to all stakeholders. Clear and concise reporting of audit findings is essential for driving change. Audit reports should summarize the methodology, results, and recommendations for improvement. In radiography, sharing findings with the entire team ensures that everyone understands the issues and is committed to implementing solutions. Transparent reporting builds trust and accountability. After reporting findings, the next step is to develop an action plan. This plan outlines specific steps to address identified issues, assigns responsibilities, and sets deadlines. In radiography, action plans might include updating protocols, scheduling training sessions, or investing in new equipment. A well-structured action plan ensures that improvements are implemented efficiently and effectively. Implementing improvements requires commitment from the entire radiography team. Changes may involve revising standard operating procedures, enhancing staff training, or upgrading technology. Effective communication and ongoing support are key to ensuring that new practices are adopted and sustained. Monitoring progress helps identify any barriers and ensures that improvements lead to better patient outcomes. Re-auditing is an essential part of the audit cycle. After implementing changes, a follow-up audit assesses whether improvements have been sustained and whether further action is needed. In radiography, regular re-audits help ensure that standards continue to be met and that patient care remains at the highest level. This ongoing process supports a culture of continuous improvement. Conducting clinical audits can present challenges such as limited resources, time constraints, or resistance to change. Addressing these barriers requires strong leadership, effective communication, and a commitment to quality improvement. In radiography, involving the whole team and providing necessary support can help overcome obstacles and ensure successful audits. Participating in clinical audits contributes to professional development for radiographers. Audits provide opportunities to learn new skills, stay updated with best practices, and demonstrate a commitment to quality care. Engaging in audit activities can also support career progression and professional recognition within the healthcare sector. Clinical audits help radiography departments comply with regulatory requirements and accreditation standards. Regular audits demonstrate a commitment to quality and safety, which is essential for maintaining licenses and certifications. Compliance with regulations also protects patients and enhances the reputation of the radiography service. Patient safety is at the heart of clinical audit. By systematically reviewing practices and implementing improvements, radiography teams can minimize risks and prevent harm. Audits help ensure that safety protocols are followed, equipment is maintained, and staff are trained to deliver safe and effective care. Improving patient outcomes is a primary goal of clinical audit. By aligning radiography practices with best practice standards, audits help ensure accurate diagnoses, timely reporting, and effective treatment planning. Better outcomes lead to higher patient satisfaction and improved overall healthcare quality. Clinical audits can also support better resource management in radiography departments. By identifying inefficiencies or unnecessary variations in practice, audits help optimize the use of equipment, staff, and time. Efficient resource management contributes to cost savings and improved service delivery. Advances in technology have transformed the audit process in diagnostic radiography. Digital imaging, electronic records, and data analytics make it easier to collect, analyze, and report audit data. Embracing technology enhances the accuracy and efficiency of audits, supporting better decision-making and continuous improvement. Effective communication is vital for successful audits. Sharing audit plans, findings, and action steps with the entire radiography team ensures that everyone is informed and engaged. Open communication fosters collaboration, encourages feedback, and helps overcome resistance to change. Strong leadership is essential for driving the audit process and ensuring that improvements are implemented. Leaders in radiography departments set the tone for quality improvement, motivate staff, and allocate resources for successful audits. Leadership support is a key factor in achieving lasting change. Training is an important component of the audit process. Radiography staff need to be familiar with audit methods, data collection tools, and best practice standards. Ongoing training ensures that everyone has the skills and knowledge needed to participate effectively in audits and implement changes. Accurate documentation is critical for successful audits. Keeping detailed records of audit plans, data, findings, and actions ensures transparency and accountability. In radiography, thorough documentation supports compliance, facilitates re-auditing, and provides evidence of quality improvement. Engaging the entire radiography team in the audit process increases buy-in and ensures that improvements are embraced. Involving staff in planning, data collection, and action planning fosters a sense of ownership and motivation to achieve quality goals. Team engagement is key to successful and sustainable audits. Providing feedback is an important part of the audit process. Constructive feedback helps staff understand what is working well and where improvements are needed. In radiography, regular feedback sessions encourage learning and support a culture of continuous improvement. Clinical audits can drive innovation in radiography practice. By identifying areas for improvement, audits encourage teams to develop new solutions, adopt best practices, and experiment with innovative approaches. Embracing innovation leads to better patient care and keeps radiography services at the forefront of healthcare. Improving the patient experience is a key outcome of clinical audits. By focusing on aspects such as communication, comfort, and efficiency, audits help radiography teams deliver care that meets patients' needs and expectations. Positive patient experiences contribute to better outcomes and higher satisfaction. Ethical practice is fundamental to clinical audit. Audits must respect patient confidentiality, obtain necessary permissions, and use data responsibly. In radiography, maintaining ethical standards ensures that audits are conducted with integrity and that patient trust is upheld throughout the process. Clinical audits play a vital role in risk management. By identifying potential hazards and implementing corrective actions, audits help minimize risks to patients and staff. In radiography, regular audits ensure that safety protocols are followed and that risks are proactively managed. Quality assurance is closely linked to clinical audit. Audits provide evidence that radiography services meet established standards and deliver high-quality care. Regular quality assurance activities, supported by audits, help maintain consistency and reliability in imaging services. Service improvement is a key benefit of clinical audit. By systematically reviewing and enhancing processes, radiography departments can deliver more efficient, effective, and patient-centered care. Continuous service improvement supports better outcomes for both patients and staff. Positive organizational culture supports successful clinical audits. Encouraging openness, learning, and accountability helps radiography teams embrace audits as opportunities for growth. A culture that values quality improvement leads to better patient care and a more supportive work environment. Summary: clinical audit is a powerful tool for ensuring that diagnostic radiography services meet the highest standards of care. By systematically reviewing practices, implementing improvements, and fostering a culture of continuous learning, audits help radiography teams deliver safe, effective, and patient-centered care. Embracing clinical audit is essential for maintaining excellence in diagnostic imaging.